AnibalShow.com.
Transportation, education literacy, and health literacy, not only the ability to read, but the ability to comprehend information that can help us prevent illness or injury and promote healing. And we also want to focus on funding resources, obtaining funds, and ways to leverage financial resources to maximize organizations and their services. I'd like to introduce now Dr. Chris Parker. Dr. Parker, if you come up, he's going to report from our last meeting and provide an orientation to the packets that you have.
I hope this year is filled with good things. Last year was relatively trying for many of us. We had a significant recession that I'm hoping in the rain. What is that we're actually past that. So as you heard, my name is Chris Parker. I am at the Georgia Health Policy Center at Georgia State University. And last time around, I was actually here primarily because of some work that we had done with the University of Wisconsin, Robert Wood Johnson Foundation, in the rolling out of the county health rankings. It was a wonderful meeting. I said then, and I'll say it now again, that the great diversity of individuals who are inside this room is kind of the reason that I come back. I would really like to see these efforts work. And so to the extent that I do that to all the commutes, which is probably just about the same time it takes me to get to work in Atlanta, I come across, I'm here, and I plan to be as present here as I can be. I must apologize that might take me only through to about 1 o'clock, but we already have a system kind of organized to ensure that we wrap things up in a way that you'll be happy about. So I want to walk us through initially what's in your packets, and then by extension speak just a little bit to the report that's in your packets. You heard mention of the kind of two front end, the back end and front end of this meeting. We have an agenda which kind of details how today will run. We'll have an opportunity after this is done to hear some presentations that will provide context for the work that will happen very early in the afternoon. But this is a work meeting, and the tables, even though they're not yet organized, they've been tagged so that we'll be working in these 4 groups to kind of get to the devil in the details of some of the action that needs to occur in an effort to make Augusta that kind of healthier city that you're looking for. The back end of that is the evaluation. And as a facilitator, one of my principal roles is to try and ensure that this gets filled out at the end of the session. And to that end, we're locking the doors, so to leave. It's not as serious as that, but we really invite you. This is kind of how these meetings are made stronger. This is how we actually got folks who were actually dying before they got to age 75. That number was a little bit bigger than we wanted to be. It was certainly bigger than the state on average. There was the issue with low birth rate. And so those were kind of 2 of the issues. When you think about what we had in that 1-pager, that kind of came to the fore. And there was quite a bit of discussion about both. Then when we looked at some of the other areas, around healthy behaviors, the challenges were obesity and smoking and sexually transmitted diseases, where the number was really very alarming. From a clinical care perspective, the overall rank was very good. I think it was 13 of the 159 counties. And yet there was still a challenge there with the number of uninsured. And so in the group's wisdom, chose to tackle the issue of access, which is a huge issue that we'll speak some more about today. In socioeconomic factors, high school graduation rates and children in poverty were 2 areas that kind of jumped out at us, and that's kind of summarized. And then finally, from the standpoint of the environment, the access to healthy foods was actually a challenge. So this group, or members of this group, took the opportunity to learn some more, hear from presenters, brought into the room their own experiences and knowledge, and made a determination that there were these 4 areas that need to be concentrated on.
And so this is what this is all about. It's really to improve the health care, really to understand our community better, and in a very high level way. We've had data all along, but this formal process that we're talking about was really motivated by healthcare reform And actually, nonprofit hospitals are required to do community health assessments, and also to, once they find the need that they want to address, actually to move forward in addressing a particular need. Am I loud enough now? Are you hearing in the back? Okay. We also are required by healthcare reform to actually do something, to actually address a community need. And so that is going to, this community health assessment provides the basis for action. It is formalized. Our partnership includes University Health System, GHSU, a GHS Medical Center, our entire enterprise. And as you all know, we have a new partner joining us, and so that'll be fun too, with Augusta State. And then very active with us is also our health district with Dr. Katie Gonzalez. She couldn't be here today. She was planning to come and actually do this, this presentation and about the data, and she at the last minute was called away. And but we are sharing the resources through this. It is a partnership, and we are actually having the same kind of data that's going to be available, and it'll be on the website. So I'm not going to give you a lot of detail. I don't have a lot of time, but you will be able to look up things you've never been able to look up before, or at least with ease that you've never had before. We often can find these data, but it's going to be consolidated in a way that will tell you for your county, actually at the, how far are we going down? The census tracts? The census tracts. You see, go all the way down to a tract. If you have a little area that you want to look at. Last night we were meeting about the Lady Walker Bethlehem revitalization project. And we can actually go there with these data, looking at those various census tract there, as opposed to zip code, which is bigger than that area. So you can actually go in and see how it ranks with the rest of the counties in the state and so on. Looking at county rankings. Chris Parker's already brought up the county rankings. Those are critical. It sharpens our view right into the needs of our counties, even just a one-pager. But this website that we will have through the university and through GHSU will be incredible. That won't be available until February. That's our plan. Chris has already gone over this, so I won't go over it again, but it is striking our needs here with our mortality, and that these rankings are how we rank 1/4 out of 156. Now, some counties actually did not report. We don't know why that was, but just 3. But we do have 159 counties here. But you'll see that we rank poorly in mortality and morbidity, health factors. In clinical care, we rank better. They count the actual providers that we have.
All here was the lack of a directory. But we all know when we've created directories within our own organizations, they're obsolete pretty much by the time they get away from the print. So that is something that United Way took very seriously in terms of information of all types out to the community. We are the only comprehensive information and referral resource in the community. Many of you probably are familiar with specialized information and referral. For example, Area Agency on Aging has a telephone resource center for aging and disability issues. And believe me, even though we have a number of resources listed in our database, we know that they're the local experts. And so we always give that referral to people calling for aging and disability. Georgia Legal Services, when they have grant funding, will produce what we've always called the Little Red Book. But it seems like from time to time that they can produce it, now they're changing the color of the cover. So it's no longer the Little Red Book, it's whatever the color happens to be right now, and I think it's green. But as you might imagine, that information, if it's out there for a year, that's not good information on the back end. It's not as accurate and up to date as it was on the front end. The beauty of what I'd like to show you today is that we are now in the 21st century, happily, with this comprehensive information and referral system. You no longer have to call 211 to access it. You can actually go online and access it. And we debuted this on December 14th to the community. Press release went out. We got some play from at least one of the television stations. I heard it on a couple of the radio stations. We had an article about it in the newspaper. You can access the 211 surgical database from the United Way website, but then there's also, and I've provided a copy of the press release for each of you, that it has the web address on it. But we really want people to know that our providers, case managers, discharge planners, social workers, office managers in a physician's practice, any of those folks can go in and access this information on behalf of our clients.
With Augusta Public Transit, it started out in 1860, and over time, in the 1930s, the system was converted over to buses. And as of last year, in August of 2011, that's when Augusta Public Transit, the city of Augusta, Richmond County, contracted out, outsourced the transit system to a private company, Mobility. And that's who I work for. Mobility, we operate transit systems throughout the country. We have wealth of knowledge regarding alternative transportation, fixed route transportation, paratransit, taxis, basically any type of mode of transportation. That's where we have our background in, and also technology. The management, as you see, I'm the general manager. Ms. Sharon Daugherty, she's the transit contract manager. That's who I report to as a relationship with the city of Augusta, Richmond County. And my other management staff, I have Denise Mulkey here, who is the special services manager. And I also have Irene Simpson here, who is my safety training and quality services officer for us. And our facility housed several different departments. One of the things we want to make sure is that we're providing a safe, reliable, and efficient transit services to our community. So we make sure that we have the necessary departments to keep people in place in order to provide that information or provide that service. For the fixed route service, we have 9 routes that we operate per day. The buses that we have out there during the week, Monday through Friday, we have a total of 12 vehicles in service, and on the weekend we have a total of 9 vehicles in service. One of the discussions today is about communication. How can we make sure that we communicate our service to the community and make sure that that information is always updated and available. And one of the things that we have worked on this year and incorporated into our service maps are the QR codes. And a lot of people now have the smartphones, the iPhones. So if you go to, and even on the screen here, you can go and zap the QR code. You can pull up Mobility's website, find out what's the latest information that our company is doing. And you can also pull up Augusta Public Transit, see where the bus routes are, see what's going on within the city of Augusta. Also, you can pull up policy procedures and information on the transit service. And again, the vehicles, we have 23 fixed route vehicles. This is some of the coaches that we have. And we also have 8 ADA paratransit vehicles. All our fixed route buses and paratransit buses, they're ADA accessible. We have the wheelchair ramps, wheelchair securements. All the drivers are trained on wheelchair securement, passenger assistance. We also have the bike racks on our fixed route buses as well, and see if they want to renew, and then they'll purchase X amount of passes. And that way, if the students want to go from their dorm to the mall, they can do that. They don't necessarily have to use the transit to go to the university. So this is our way on trying to educate the younger population about the transit system and move them more out of their cars onto the system. These are some of the focus points that we addressed to the commissioners when we first came in, and what we're looking at for the community, what we're looking at for the transit system. I'm originally from Florida, that's where I'm born and raised there, but I worked on large transportation, and when I came here, I moved out in Columbia, and I'm in the DMV office, and they recognized me, and they said, Mike, when you going to get transportation in Columbia? I'm like, you don't get transportation in Columbia? And they're like, no. I said, yeah, I know. But that's one of the things we're working on. I have spoken to some of the governing bodies out there, and they're interested in it. But it's going to take a little bit of work, more education, and they're trying to set me up to have a meeting at one of their board meetings, so then I can be able to address how we can better serve that community.
Especially to literacy. We see at the Literacy Center between 250 and 350 people that we tutor every week. So that means over 1,000 a month. We do our services absolutely free of charge to everyone that we tutor. And we tutor Mondays through Thursday from 4 to 8 p.m. right behind the Newman Tennis Center in front of the Forest Hills Golf Club. And we're tutoring when the Forest Hills Golf Club parking lot is totally empty because most of the time they're not playing the hours that we're tutoring, so we use that facility. We also have people come to us on public transit, so we're able to take advantage of that. We have people who are children, adolescents, and adults who come to us. Sometimes entire families. And we always maintain a waiting list, but not a long waiting list. As soon as someone feels like they've maximized our services, we try to bring someone else in. Our center is really a training center for our tutors. Our tutors are students from Augusta State, undergraduate as well as graduate. All our special ed majors, graduate and undergraduate, tutor with us for a full year, fall, spring, and summer semesters. Our tutees often are individuals, almost always, who have special needs of all kinds. And if an individual has problems with their reading, and they're also having difficulty with math, science, social studies, language arts, we help them with those content fields as well. We get people who tutor for us from our university, of course, from all of our colleges. We have tutors from the College of Business, Arts and Sciences, College of Education. We have tutors who come from the sciences. Certainly we have tutors who come from nursing. So we have every field covered. Right now, for instance, in our EDLR 2900, which is a 1, 2, or 3 semester hour elective course, I have over 50 individuals who signed up to tutor right now. All our special ed majors, as I said. We have people who come in where English is a second language, and so we get some foreign language majors who are able to work quite often with that. So we try to tie our program directly to the programs that we offer.
AnibalShow.com